Problem-Oriented Medical Record (POMR). Reporters for this topic are Dwayne Adan, Lorraine Mequila, and Celine. So, what is POMR? POMR is a short term for Problem-Oriented Medical Record, first introduced by Dr. Lawrence Weed. POMR is a comprehensive approach that Dr. Lawrence Weed began using on the late 1950s. It is a method of recording data about health status of a patient in a problem-solving system in an easily accessible way that encourages ongoing assessment and revision of the healthcare plan by every actor in the healthcare team. POMR gathers information from all members of the patient's care team in order to determine a diagnosis and create a treatment plan. What is the purpose of a POMR? The purpose of POMR is for teaching and learning. It emphasizes a systemic analytic approach, help you learn the patterns, integrate the problems and the causes, maintain focus on the patient and his and her problems. Also, for communication among members of medical team to optimize the quality of care and minimize the potential for mistakes, as well as to keep legal record.
Problem-oriented medical records has 5 basic components: database, complete problem list, initial plans, daily progress note, and final progress note or discharge summary. Database includes history, physical exam, and laboratory data. The importance of database is obvious and must include a complete history and physical exam. Many hospitals include certain routine laboratory studies like CBC, SMAC, EKG, chest X-ray, urinalysis, and more for each patient admitted. If these are available to the admitting physician, they are to be included in the initial database along with a history and physical. As additional information is collected, it is added to the database. After the admitting physician performs the history and physical, reviews the basic laboratory data and records the database. The problem list is constructed and recorded. The construction of a problem list is the initial step of what physicians really do. That is, once they have seen the patient, physicians think about and define what is wrong with the patient or what are this patient's problems. These are the important facts to be noted in constructing a problem list. First is a problem should be defined at its highest level of defensibility. Second, the problem list must include all abnormalities noted in initial database, and each abnormality needs to be separately recorded. Third, the problem list is refined as problems are either resolved or further defined. Fourth, if the initial database is incomplete, the problem list must state so. And lastly, the positive review of systems. The next process that a physician undertakes after deciding what is wrong is what to do about what is wrong. This is the initial plan and must be written by the admitting physician after the problem list is constructed. For each problem defined, a SOAP note must be recorded. The subjective and the objective are each a brief review of the abnormalities identified in the history, physical, and initial lab data, which pertain to that particular problem. This need not to be lengthy, but simply one or two lines reviewing the pertinent data. The assessment is a brief but pertinent paragraph describing what the physician thinks about that particular problem. And lastly, the plan must be include three distinct groups. First is diagnostic plan, and this includes all the diagnostic workup which the admitting physician feels will be necessary. If the assessment includes the differential diagnosis, then in, each must be ruled in or ruled out in the diagnostic plan. Next is the therapeutic plan, and this must detail all initial therapies started and their rationale. And lastly, patient education plan, and this details the initiation of plans to educate the patient of what the problems is and how the patient will deal with it in the future. Many physicians object to the problem-oriented medical records because its use results in lengthy redundant progress notes. However, when used properly, the problem-oriented medical records does just the opposite and results in notes that are clear, direct, brief, and complete. A few helpful hints regarding the progress notes are the following. First is a note for each active problem identified need not be written every day. If nothing has changed regarding a particular problem, a note for that problem need not be written. An observer will refer back to the prior day's note to get a progress report on that particular problem. Second is the subjective, objective assessment or plan need not be written. Need not be rewritten if nothing is changed for that particular aspect of the problem. Lastly, a common error in writing daily progress notes concerns restating the problem under the assessment in the daily note. The final progress note should include all active problems and each defined as to its furthest resolution on the problem list. The subjective should include a brief review of the course of symptoms. The objective should review the course of objective parameters. The assessment and plan should include the probable course to follow and define endpoints as a guide for the further therapy. The emphasis on the final progress note should be unresolved problems. Problems which are resolved can be written up briefly.
Advantages of the problem-oriented medical record. It is a comprehensive approach of recording and accessing patient medical data. With the proper use of the POMR, it can result in a concise, complete, and accurate record keeping. It also excels at organizing information within medical record documents. It also makes it easier to track illnesses since data is organized. It is also beneficial for documenting chronic illnesses, which may require multiple treatment methods that must be adjusted over time. It also helps the doctor understand the nature of their patient's diseases more completely. The POMR improves communication among healthcare providers. It also helps avoid inadequate hypothesis generation and misinterpretation of findings. Aside from that, the physician can be reminded of all the patient's problems at each encounter because speed retrieval of medical data is possible. It is also helpful when the physician is trying to assess rapidly the patient's status. Disadvantages of the problem oriented medical record. Extra commitment and training is required of the medical staff that makes entry in the medical record. It is also a time intensive process that requires significant interaction with patients and extensive tracking of health information. Documentation, entry, and review can be very time consuming, especially in patients with multiple problems. It is also not that useful when entries made were inaccurate and not well maintained. It is also less likely to be used in an outpatient setting. And that ends our discussion. These are our references. Thank you for watching.